Hello guys, I'm Harshit Ram. I play basketball occasionally. Like I play for my university. I got ACL reconstruction done like 6 months ago. After I ruptured my ACL, I tore it completely. And after the fourth month, after third or fourth month, I developed like really bad stiffness. I couldn't walk properly. I used to limp all the time. Felt like hell. I think it developed due to the annual physiotherapy. I don't know the reason, but it was really bad. I couldn't walk. I had like at least 30 degrees lag. I couldn't straighten my knee properly, and then I've decided to come to Hyderabad for the treatment to know what's the problem behind all this. I was completely lost for at least 2 months. I don't know what to do, but like I'm really lucky. I consider myself really lucky to have Ravi Teja sir as my surgeon. I can't describe. Like I feel really lucky. It was like a miracle right after the surgery, and I got 0 degrees extension. Now after 1 week, I'm able to walk properly. It's not the same anymore. Now it's all in my hands. He has done his duty. Really thankful to him for all this. Now I'm able to walk again properly. Now it's all in my hands to keep this up.
Hi, I'm Dr. Ravi Teja Rudraraju, consultant knee sports medicine and robotic surgeon in Apollo Jubilee Hills. We have here Mr. Harshit, as you have heard from him. It's a very rare scenario where someone will undergo an ACL reconstruction and end up with some kind of a complication. Genuinely, we don't want any patients to end up having arthrofibrosis, which is a stiff knee after the surgery. If you ask me why, there are no particular reasons. It can be because of aggressive physiotherapy, it can be because of some injury after surgery, or it can be inherently some predisposition to that condition. So retrospectively thinking, we cannot figure it out why, but again, some of the common causes, as I mentioned. Whatever it is, I think any person who undergoes these kind of surgeries, we expect them to get back to a very active life, playing back sports and living their life at the fullest. But arthrofibrosis is one such condition which is very debilitating. As in go, we have more months coming in, or more time goes on, so it becomes more and more a problematic thing, because your knee becomes very stiff, and sometimes you might have to redo the whole procedure to fix it up. I think Harshit was smart, did what he can do, but he realized it is not going well forward. So I think he came and saw me. We kind of evaluated very well, getting an MRI, examined him thoroughly, understood the problem, and tried to instigate why it has come in the first place. After doing thorough investigation, we found out that he ended up with arthrofibrosis, which is a stiff knee. We got the MRI done, and we had a plan on how to go forward. I've given enough understanding of the situation. I've explained him how to go forward, what we are going to do in terms of resolving this issue. So our plan was to manipulate the knee to try to bring as much of flexion as possible, and to correct the fixed flexion or the lag that he was mentioning. So we took him up into the theater. After anesthesia, we tried to kind of manipulate the knee. So we were able to get some bit of flexion during manipulation after anesthesia. I think he was started around 30 degrees of fixed flexion, and we went up till more than 90 with manipulation, but we could not achieve complete extension with just manipulation. So I went ahead and did an arthroscopy, and during the arthroscopy, I kind of again debrided the whole of the joint, particularly the tissue that was kind of impinging the complete extension of the knee. More importantly, inside the notch of the knee where the ligaments are usually there, like the ACL and the PCL, it is overstuffed with arthrofibrosis. So I took enough time, patiently did kind of joint debridement, arthroscopic adhesiolysis with the shaver blade that we have as a tool. There was a very stubborn, thick tissue that was formed inside. So lucky that we were able to correct most of it, and we could kind of completely clear the notch, completely clear that tough tissue that was kind of stopping the complete extension. So I'm very, very happy to share that during the procedure with manipulation plus arthroscopic adhesiolysis, we were able to achieve a complete flexion of around 130-140 degrees of the knee, plus almost extension. And after that, we have started with an aggressive rehab with CPM, which is continuous pass-through motion, plus additional rehab. I think he is now 2 weeks out, and I'm very happy to see and glad to share that he is able to completely extend his knee and is able to now more than flex about 100 degrees of his knee, and I'm very positive that he'll be able to achieve more flexion in the coming weeks. It's a typical example, or an example where we need to be very careful with post-operative physiotherapy after any ligament surgery, particularly the ACL or PCL or any of that sort. So I just wanted to share this example so that any of patients who undergo these procedures will not end up having this kind of issues. And unfortunately, if someone ends up, I think you might have heard from me and Harshit, what has happened and how did we come back to normal. But I should thank Harshit and his parents that they have trusted me. They have stood by my decisions, and I'm very happy for them as well as to Harshit that he's getting back to normal life, and I expect him to get back to his favorite sport. Thank you once again, and looking forward to seeing you anytime soon. Thanks.